Okay. So we are now live on YouTube. And good evening, everyone. I'm Dr.
Yeah.
Pratyush Kumar, Executive of World Organization of Family Doctors. And we are here in the first session of Google Hangout discussing about osteoarthritis in elderly healthcare. And today with us, we have got Pratyush Chatterjee, who is a senior journalist with special interest in health and interlinked issues. And she has got extensive work done on the health, and she has written many projects for WHO, UNDP, and UNICEF. And she's a public speaker and media trainer. So let's begin the discussion with Pratyush itself. Now to over Pratyush.
Hello, good evening. This is Pratyush Chatterjee, and I'm a health journalist, as Dr. Pratyush Kumar said. And I'm really delighted to be, joining, and I'll be moderating this informal discussion that we are here having this evening with actually people from different cities, different countries. Hopefully, people will be joining us. And I'm in Delhi, and we're going to be discussing something and with a special emphasis on osteoarthritis. Um, Elderly healthcare doesn't, I mean, I'll speak from a popular, media perspective. Elderly healthcare doesn't really get the kind of attention it deserves. And this is very unfortunate because I think in India itself, for instance, we have more than 104 million people, according to the last census, who are elderly, 53 million men, and I think over 50, women. And this is expected to go up to 173 million by 2026. So um, this I'm really looking forward to this discussion. Osteoarthritis is a condition which most of us know it as something which causes joints to become painful and stiff, and it's a very common type of arthritis. It of course affects the elderly the most. People who are obese are likely to also be vulnerable. Also, if you have a family history and if you've had a joint injuries, other conditions. And we have a distinguished panel of doctors from various cities and various countries joining us. So I'll start with asking Dr. Chandrakant Laharia, a public health specialist from India, about the broader issue of elderly health care. And, if you want to also talk specifically on osteoarthritis, is this a big problem? And how is it being managed? Dr. Chandrakant.
Thanks, Patrulekha, and good evening, everybody. Good evening from New Delhi. I work here in New Delhi, and my major focus of work is on health systems and universal health coverage. And in last 15 years of my work, what I have realized that issue of aging or elderly not getting sufficient attention, not only in India, but other parts of the world as well. There are numbers available which are really staggering. The elderly or people who are older than 60 years were around 900 million in year 2015. And this population is likely or expected to reach 2 billion by 2050. In other terms, the population which was in 2015 was 12% of total population of elderly will reach 22% of global population by 2050. In 2050, 22% of global population will be elderly. And what is important to know that this population is increasing rapidly. For example, it took France nearly 150 years from reaching 10% of their population being more than 60 to becoming 20%. Now, in 2015, France had 20% of their population. It took them 150 years to double. But in countries like India, China, and Brazil, this would take very less time, around 20 to next 20 to 30 years. These countries would double their elderly population, as Ms. Patrulekha also identified. Now, what we need to remember, and from health sector perspective, that most common health conditions in older age group are non-communicable diseases, which are a broad range of diabetes, hypertension, chronic obstructive pulmonary diseases, depressive disorder, dementia, and osteoarthritis. However, we already know that NCDs are emerging, but our health system in most of the low and middle income countries are not designed to provide care for elderly. That's one. Second, the issue is that they require a sustained long-term care. And third, even if they use they are elderly, a smaller group of population, they require more frequent care seeking than other section of population. So even for a smaller section, they would consume a lot of health services. And that's what we should be paying attention. So I would stop at this point of time and maybe join again.
That's really interesting because, you know, when I sort of look at, you know, this kind of in medical literature, osteoarthritis, it sounds actually quite serious, you know, protective cartilage on the ends of your bones breaking down, causing pain, swelling, problems moving the joint. And yet, as you say, you know, this is the kind of problem which is affecting increasing large numbers of population, and also I think lack of exercise and obesity probably hastens this, or you know, it can probably affect even people earlier on. And you mentioned that the public health systems in a lot of countries, at least in the developing world, are not really geared. So, do you? I mean, how is it being tackled really, you know, in different countries? And Dr. Pratyush, would you like to, you know, share your thoughts on, you know, what family doctors are doing to address this problem?
Yeah, it's a osteoarthritis. We shouldn't see just like a problem joints, because apart from joints, obviously it causes lots of pain in doing their daily life, but it also affects their quality of life. It affects uh, their job profile. It affects their social life, and so it's associated with complete health profile of a person. So beyond just a management issues, it's we have to take it as a complete package. And in our daily geriatric OPDs, almost the prevalence of osteoarthritis, like most of the people above 70, 80, they get osteoarthritis. The only thing is what varies is the severity. Some may have a very minor osteoarthritis, and some may have a very severe osteoarthritis that may require a medical management. We also have now got surgical management for the care of osteoarthritis, which is managed by the orthopedic surgeons, which is called as knee replacements. And now the government has also reduced the cost of knee implants in India. So that's a good thing, what's happening in India. And we also have Dr. Gobit from Sri Lanka, who would also like to join in to discuss about osteoarthritis management from Sri Lanka. But,
Welcome, Dr. Govind. And, you know, I've been to your country, and I think Sri Lanka is, you know, justifiably known the world over for its excellent health system. So it would be really, you know, interesting to know what Sri Lanka is doing. And once you have arthritis, it's probably difficult to completely cure it. So could you please share your thoughts on how it is being tackled in Sri Lanka, not just treated, but also the preventive aspect? Dr. Govind.
Yeah, good evening, everyone. This is Gobit from Sri Lanka. I'm a young family physician and academic from based on Jaffna and Colombo. Basically, this is the elderly population is the part of the global problem. As with the improvement of health services and quality of life, all the life expectancy of the human gone up. Earlier, we see it start around 50 or some like 50 years. Now, even almost in the world, it is around 70, even in Sri Lanka also around 75 to 80. So basically we are having a lot of percentage of major population of elderly people. So in the same time, this we are talking about the osteoarthritis today. So this is also one of the major issue in the elderly population, because it's normally starting in the later part of the life. So the mainly affect with the elderly people. So easily they are fragile with these all the bone diseases, and as with that, as Pratyush said, it is very difficult, very burden to them to move around. Maybe we can say is a daily activity of daily living is limited with that. So we should take the proper measures to read them. Maybe as we said, must be we have to take the action to prevent or primordial treatment for that.
So how is it done? Sorry, Dr. Govind. So how is it? How do you tackle this in Jaffna? Is it part of, do people come to you early enough, or do you see mostly the patients who are coming to you very late when the problems are already severe? How is it being tackled in Sri Lanka?
Yeah, here we are getting as a family doctor. Normally, here patients are right to go whichever the places want to get the treatment. So we are the primary care doctors. The patient first come to us. So before maybe going for the specialist. So we are the first people to see the problem. Maybe in the later stage, maybe in the early stage, whatever that. But first, patients have started coming bit early nowadays because they started with the pain and tenderness and all. They come and ask, even they don't know this may be the osteoarthritis, maybe they think something on their joint and bones. So if we go for the proper way and to diagnose, and if you go for the guidelines to treat and cure, then we can help them a lot. But in the same time, still we are getting more later stage patients as well. So compared to like 5 or 10 years previously, now we are, I think, doctors and or medical professionals are doing very good service to them on this osteoarthritis, because people are, I think, bit aware and they are coming in. There's some kind of promising treatment and services are there. So
apart from surgery, which is of course at the extreme,
yeah, because
the government, or are there any initiatives which are being taken to spread awareness about this, and also what are some kind of lifestyle changes which are advised so that people don't have this in the most severe form, or at least prevent it?
Yeah, actually, for the risk factors we have talked about, obviously, is one of the risk factors the elderly, and for the sex-wise, as a female gender is more, and as well the main other causes like obesity and some other deformity of the bones and all. But whatever they said, Chandrakant said about the non-communicable diseases. So here, what we are initiated. So we are encouraged to screen all the people over the 40 years for the non-communicable diseases. So when they attend for that clinic, so services, they have a chance to screen everything, like including this joint, because they obviously they are going for the health. They think they are healthy, then coming for the health services. So we have a chance to catch them in early stage. So in the same time, we can concentrate on the obesity and is there any other risk factor like bony problem and any early stage of osteoarthritis we can identify and we can treat. So the better here is we are had to identify from the early to read medically. So for that we should have some mechanism. So currently we have some sort of mechanism screening and NCD, non-communicable disease, in the around 40 years. So that is one of the major advantages, I think.
Oh, that's very interesting. I think we also have with us some young doctors who recently graduated, and it would be also good to have their perspective if somebody wants to share their thoughts on, as people who are just about to join the profession or who have just joined the profession, is this area of elderly healthcare, do you think it's getting sufficient attention? And any thoughts on this, with specific, focus on osteoarthritis?
Hi, my name is Dr. Harsh, and I just recently graduated. So, coming from the very lowest possible situation, not much importance is given to the elderly. I mean, the only time they're given importance is it's either too late for them, or if they have sufficient exposure around their region. So it's not a very it's yeah the elderly is not given that much importance, as in it is given importance, but it's not enough.
Yeah.
I would like to add.
Yeah, sorry. Please go ahead.
My name is Mokshita, and I've also recently graduated, and I'm from Mumbai. And I know as students, we believe that our medical curriculum does not sufficiently talk about geriatric healthcare. I wouldn't go in specifics about osteoarthritis, but we haven't learned a lot about how to deal with age-related issues in our undergraduate. And also, I'm not sure, we are not given the options to see whether there would be postgraduate courses regarding geriatric healthcare. And for that reason, not a lot of students are going towards fields where we would need doctors for the aged. So I do believe that it would be important for governments and medical schools to bring in education, make changes in medical education that would result in students wanting to get into a profession of geriatric healthcare.
That's very interesting. Dr. Chandrakant, you have a lot of experience, and you're a well-known advocate of universal healthcare. What are your thoughts on this? We've been now heard people thinking, I mean, clearly this is a problem. We know in India, and also, one of the determinants is obesity, which in India, I think that's also increasing, as in probably many other parts of the world. What are some of the, possible solutions, and how can we, manage this problem better?
Well, thanks. I guess this is the most appropriate time to bring discussion on elderly across the world. What is the best part about this entire discourse is that now people are increasingly recognizing the need for services for non-communicable diseases, and elderly population is affected by this group. But beyond that, the NCD services, or even NCD as well as osteoarthritis, all these require a different approach of health service delivery, which means a broad range of preventive, promotive, curative, diagnostic, rehabilitative services are required. And this discourse is in the terms of NCD as well as in terms of universal health coverage at the peak at right now. In addition, what is being discussed that the primary healthcare should be the focus of delivery of many of health services. All these three things, NCD, UHC, and primary healthcare, has been captured at a much broader level, and that's what I would spend the next 2 minutes to talk about, has been weaved into Sustainable Development Goal 3. And the goal reads like ensuring healthy lives and promoting well-being for all at all ages. What it means that you cannot achieve SDG 3 unless elderly healthcare is addressed. You cannot achieve universal health coverage unless health services for elderly population are provided. UHC is essentially about three things. More population covered, so elderly should be covered. More services should be provided, so the services which are required for elderly are being provided, and financial protection. In addition, so how other countries are doing and how it should be done, there are two things which are essential to achieve UHC. One is when countries are working to achieve UHC, they are focusing on expanding the package of health services they provide. So benefit package, that's what it is called. Benefit package means what government or health system would offer to the different set of people. And in context of elderly, there is a need for paying specific attention, so the services which are needed for elderly are part of benefit package. It is also called age-friendly benefit package, which means osteoarthritis services, diabetes services with focus on elderly, where they are living, what they do should be covered. So that's one part of UHC. And I would conclude with saying that in process of offering these services, efforts should be made to make them affordable also, because it's equally important that services are provided, but they are affordable to the people. And in some countries, these are free of cost. But the challenge is when they are offered free of cost, the package is narrow. So the approach which most of the countries, including India, are attempting to follow is a social insurance system. And in that, the definitive mechanism need to be designed that elderly are covered The challenge in front of India and most of the low and middle income countries that most of the people are in informal sector, so they do not get any such package as part of their social health insurance package. Even in India, some of the initiatives are happening, but those are for a specific target population, bottom 40%. So to summarize everything, countries have made the commitment to achieve UHC. In the process, in that dialogue, elderly should be covered or should be integral part of that discourse. As part of benefit package, the services, including osteoarthritis services, or all services which are needed for elderly should be by design included, and mechanisms for financial protection should be part of this process.
Yeah, I think you really touched on some very important issues. I think the primary thought that's coming to me after hearing all of you is that elderly health care needs to be on the high table of discussions on health, right? Because it is not an area which gets a lot of attention, public attention, and it needs to be there. It needs to be there because we are having increasingly a growing population of elderly healthcare, and within that, issues like osteoarthritis. Dr. Pratyush Kumar, you know, osteoarthritis, if you talk to somebody who hasn't yet got it, sounds really depressing. It sounds like something, which if you have it, you can't do lots of things. As a family doctor and somebody who, travels around the world, meeting other family doctors at probably various conferences, or, you interact with a lot of people around the world. How can we make this, if somebody has this, how can we make this seem as if it's not the end of the world? Is there a way of putting together packages, with say nutrition and maybe, exercise, or, things which are fun things to do, so that, it doesn't seem like such a depressing state, when a patient comes to you, it's not like the end of the world, or it's not like you will not be able to do anything. Any thoughts?
Yeah. So before that, I'll just like to add on something which Mokshita and Harsh wanted to say, what wanted to convey, that definitely geriatric issues are high on priority list. Only thing is that the implementation has not been that proper. But as you can see, that WHO has declared 2020 to 2030 as decade of healthy aging. So it shows that the priority means this all geriatric issues are top on the priority list from the WHO point of view. Only thing is that the implementation, that opening of post-graduate courses like MD Geriatrics has not been proper. Like in Bihar, there is only one medical college with who has got Department of Geriatrics. Even in India, we have got National Health Program for Care of Elderly, and that only promoted actually opening of regional geriatric centers, and also promoting to have post graduation courses in geriatric medicine. So that's all happening in the field of geriatrics in India. And about coming to your question about the complete package for geriatric, so we should understand geriatrics care from the point of perspective of an old man, because not only osteoarthritis is suffering from, there's also some mental health issues. We have seen that those who are elderly, they usually live alone. They usually they have got more anxiety and depression, and they also suffer from polypharmacy, because they take medicine for lots of diseases. And sometimes for osteoarthritis they take lots of painkillers, which leads to different issues, gastritis and other issues are there. So all together, like mental health issue, like anxiety, depression. So what we need to do then, we need to combine the preventive and also the mental psychological aspect in the treatment, in the primary prevention of osteoarthritis. Like we need to detect it early, we need to provide them proper counseling, like diet, proper exercise, what should be done and what should not be done should be adequately, they should be well informed to them. There should be proper counseling for all the patients regarding, and there should be uh, regular examination of joints. We must tell them that how they should understand what could be the earliest signs and symptoms of osteoarthritis. Obviously, the IEC activities like information, education, and communication strategies works well. And once the patient will be aware of the signs and symptoms, then only they can take the benefits of the medical management which is available or the surgical management which is available. So we need to really promote, we need to spend more time on patient education, on health education basically, and then only they can understand the problems. We should also make them understand that look, these kind of exercises are there, like quadriceps strengthening exercises there for knee joint problems. There are different kind of exercises are there. There are different kinds of nutritional supplements are there, so that they can use it. For if they have got some anxiety and depression, there's definitely someone who should go there and talk with them. There was a big strategy by WHO which called as Let's Talk for mental health issues for anxiety and depression. Because they need to talk out, they need to speak out so that to understand their problems in detail, what they are suffering from. Is there only loneliness? Is there or is there something else? Is it because of some problem which is leading to depression, or is depression alone which is causing them such issues? Because sometimes only because of anxiety and depression they may feel pain. It may not be organic issue, but just because of anxiety and depression they may have multiple joint pain also could be there. So that we all need to take care of while managing these cases of elderly. Thank you.
No, I think you've touched on some very, very important points, and because for instance, in a country like India, unlike say in the developed countries, we don't really have a habit. Even people in the middle class, people whom I know or who go for really everyone going for an annual medical checkup, in which everything gets tested, and that's probably why a lot of problems like osteoarthritis go undetected for very long till it reaches a severe dimension. And I think what you're saying, that to spread awareness, and I hope that our discussion today will contribute to some extent towards sharing this. I think the other point which is coming across, that it is very common that even if one has it, it should not be seen as something which you just cannot do anything about. And it would be good if any family doctor over here can also who's online can also share his or her perspective of how he or she has actually dealt with the patient who's had osteoarthritis and other interlinked issues. Do we have anybody who has dealt, or who can an anecdote or anything?
Look, usually in a clinical practice, we do see lots of patients with osteoarthritis, and it depends that how we manage this all depends upon the context and where we are practicing. Like in a government hospital where we see lots and lots of patients, we don't get lots of time to explain about the minor nuances, that what should be your diet, what should be the exercise, because of the huge patient load. But these things are really important, and sometimes we just give them calcium, vitamin D supplements, and some painkillers on a regular basis, and just ask them to follow up. But apart from that, what we really miss is discussing about the preventive aspect and about the exercise, the role of nutrition, the role of uh, to have other issues uh, associated with osteoarthritis. And that's management of osteoarthritis requires a multidisciplinary teams. Like we need to have a proper support from uh, orthopedics, from there's a department called PMR who looks after physiotherapy. There should be good nursing care. There could be a psychological support. So it requires a multidisciplinary support if problems is there. Or if it's a simple issue, the family doctors can manage on its own. But we need to know about the red flags. That's when to refer the patient to an orthopedics, that he needs a specialized management for the osteoarthritis because its severity is very high. So these things are important. And I think Gobit would like to add something from Sri Lanka point of view.
Yeah, Dr. Govind, I was actually going to get to you. In Sri Lanka, are there any new things, innovations in management which you are seeing, which you'd like to share with us?
Yeah, actually, we are getting, as Pratyush said, we are getting a lot of number of patients in the government hospital, Same here as well. We don't have a time to explain much, but still, as a family doctors, we manage to do our best. But here, I want to stress that when the patient come to us, they always think about they wanted to get some medication or tablets or something. But more than that, before that, they should have some kind of like other physical activities, exercise, and definitely the exercise and physiotherapy role a big role here. And as that we have to emphasize them, reduce the weight, but so that both will be given the more chance along with the drug treatments. So even I see our patients, they come regularly. When we say you come in 2 weeks time or 1 month time, they come to get the treatment for drugs, and but in the same time they don't consider much about exercise and dietary advices and reduce their weight. Actually, this all the joint is convey the transmit our weight into the body skeletal system. So we should have ideal body weight and proper physical exercise, proper exercise or physical activities. So along with the drugs, I always emphasize the patient do both in the parallel way. And the treatment wise, the same as like normally we mainly focus about the reduce their pain to pain, and they live happily like that. As well, we have to also be add some other medication to how to improve, how to overcome their damaged joint and all. So most of the medical parts are we manage here. Here also we have some multidisciplinary teams there: rheumatology, rheumatologist, orthopedic, and mainly with a physiotherapist and occupational therapist. And so among them, so as a family doctors, we arrange the care, and we do the most of the primary part of the management. I think almost same like in India, I think. Thank you.
I think that's very interesting what you're saying, and your point on not over medicalizing the problem, if I've understood you correct, is very important. And all the other things one needs to do, like you said, cutting down on, doing exercises, nutrition. And Dr. Chandrakant, would you like to share any thoughts on the discussion?
I think both Dr. Pratyush and Govit have raised very important points, and they have highlighted about the treatment part and also the preventive part. However, I would like to add another dimension to this, and that is, one is we are talking about the treatment of patients who are coming to the clinics of the facility, and then we are providing treatment. However, many of these interventions need to be done at the community level, where so this condition does not arrive or does not worsen. So that's one part. So we, when thinking of NCDs in general and osteoarthritis in specific, also need to look from public health perspective, that some interventions are done at the community level in the settings where people are living, and preventive or promotive education is given. So that's one part. And second, public health part in prevention of NCD and osteoarthritis, and I'm always saying this together because I see a broad spectrum, is the office or workplace, that many of these people, though not necessarily the elderly, because the disease conditions start much earlier than before people reach age of 60 years. So the intervention need to be started in their work setup as well. People who are in the early stage of or mid-career, the osteoarthritis develop because they adopt a wrong behavior or wrong practices, and in those settings also intervention need to be done. And this is a public policy part, that public health intervention should be designed to intervene at the community level, at the workplace level, to make impact. I'm stop here.
Yeah, I think it's very valid what you're saying, that yes, there is a need for treatment and there are surgical options, but there is also the non-medical part, exercises, nutrition. And in this connection, I there's an interesting, I believe Mexico has a very interesting initiative it's taken. They've got clinics which are, supported by the government, where they have, apart from the doctor, the family doctor who is tending to the patient, they also provide nutritional counseling and also free, a whole set of, physical activities, which I was told by a family doctor from Mexico recently, that it includes dancing, martial arts, aerobics, and people who come over there, and they are actually, according to their physical fitness. It's not that everybody has to get into start with the most intense physical exercises. And I thought that was a very interesting initiative, because it's happening at the clinic level, and they offer actually a whole package which people can do at the level, according to, their level of fitness. I thought that was a very interesting example.
Yeah.
And our medical students who are here and who are just starting out, what are your thoughts? I mean, you said that you would love to have had more of geriatric healthcare in the syllabus, but after listening to all the discussions, any ideas that you have which you'd like to share?
I believe that we learned a lot today from everybody who has spoken. And with our own experience in internship in our undergraduate, we did realize that there was a big gap between uh, between the doctors and especially the elderly, especially if the doctor is young, because we do not know how to deal with those kind of situations. And we realized that there is a need for geriatric training, incorporating a life course approach that should be adopted for all medical students and all healthcare workers. And training in medical schools is currently not adequate to meet the growing geriatric population health needs. So I believe that we should all advocate for ensuring that there's an interdisciplinary approach to geriatric training, and everybody joins hands, international bodies, school boards, political groups, and even the public, to ensure that the elderly are getting the best care, because it is success for health sector worldwide if we have like increased life expectancy and a happy aging population.
Oh, that sounds interesting. Anybody else who has just joined in or who would like to share some final thoughts?
Hush is there.
Yeah, Dr. Gala?
From what Mokshida said, I mean, it is very important that students and the public at the same time uh, realize the problem and move forward together, because this cannot be done only by doctors. It has to be the society who takes action against for geriatric population. Because even if doctors go all out and try doing whatever they do, but if the population in general does not support, so I think everyone has to together move forward to solve this issue that we have.
Okay.
And I think this is a real challenge in countries like ours, India, which has a dominantly young population. Because when you are young, or when you are not very old, it's probably, I mean, a lot of they don't think about these things. So, and as I think several panelists mentioned, that the problem can actually start much earlier than 60, right? It just gets worse when you are 60, so, after 60, because you've not been exercise. Then you've been having the wrong diet, the wrong lifestyle. And in a young country where you don't are not thinking of old age because you're not old, I guess it's a special challenge.
Exactly. This issue is not only this is a public health issue, and it's going to affect uh, the economic part of the planning and management of healthcare. It's going to affect the daily living, and also it's going to affect the attendance in uh, work units. Like if the patient has got osteoarthritis, they have got pain, they won't attend to their workplace, and it will also cause in some economic harm also. So there's economic prospect is also involved with uh, this disease, and also the quality of life is also involved in that. So we need to look at the larger perspective of the disease profile, not just to reduce the pain. There's a lot more associated with it. There's a lot bigger thing at stake of it. So we need to take care, looking at all the aspects, and accordingly we need to manage it.
Yeah, and I guess, I mean, say there's a huge in terms of facilities which are available, whether the family doctors, the specialists, the other kinds of nutritional guidance, exercise. I mean, in India, for instance, many cities have huge problems of pollution, right? So I mean, simple things like walking, it's not always possible. So I guess we need to exchange thoughts and share what we can what we can do to help each other. But I think this discussion has been very, I mean, for me, it's really been very revealing and very eye-opening to hear so many of you distinguished doctors and panelists who have direct experience of dealing with people who suffer from osteoarthritis, as well as elderly healthcare, other public health issues. We could end this session, and it's been excellent. And I think it's great that people, we could all join in and have this informal chat. And in Delhi, last couple of days has been terrible weather, and today it was sunny, and that all of us could find time and have this very important discussion. I think it's been a great, and thank you very much. Thank you all.
I'd like to add something here. I really want to thank all of you all to include young doctors into this conversation, because it is very, I mean, it is nice for us to be a part of this, because eventually we'll be the ones moving forward and helping with such issues. So thank you very much for the same.
Thank you so much.
Thank you, Patrulekha, for having a great session. And you really made it look excellent. And we are really happy and proud that
No, it's
you're
great.
part
I
of this
think this is
discussion.
yeah, it's an informal chat, and we could just chat, and we could just brainstorm. And I hopefully this is also on YouTube, and this is on, I think, isn't it, Dr. Pratyush?
Yeah, yeah, this is on
Yeah,
YouTube. And also,
right.
I'd like to inform to all those who are watching us now that our next session is on cognitive health issues. It's about dementia and elderly, and that will plan to have it's in next month or so. Okay.
Yeah, so we'll have these informal chats, and this will be available to the public, not just medical doctors, but patients and lay people who are interested in the topic, who are affected. And once again, thank you, everybody, and it's been a great evening, and have a great rest of the evening.
Thank you very much.
Thank you.
Thank you, everyone.
Thanks a
Thank
lot.
you. Bye-bye.
Bye.
Bye.
Thanks, Dr. Chandrakant, Dr.
Thank you.
Bobit.
Thank you very much, Pratyush, for taking lead, and Patrulekha for coordination.
Yeah. Thanks, Dr.
Thanks.
Harsh and Mokshida.
Thank
Yeah.
you, sir.
Thank you, sir.
Thank you. Bye. Take care.
Bye.